Hi, my name is Erica St.Lawrence, and I'm a current PGY2 at DMC here on Valley Sinai Hospital. And today I will be presenting my abstract entitled Isolated Iliac Artery Aneurysm and Dissection Leading to Hydroureter and Hydronephrosis. This was one of the cases that I saw during one of my internal medicine rotations with attending Dr. Batul Dagger. Iliac artery aneurysms are relatively uncommon and account for approximately 10 to 20% of all AAAs. But a solitary or isolated iliac artery aneurysm that does not involve the aorta accounts for less than 2% of all abdominal aneurysms. Of this 2%, 70% of the cases involve the common iliac artery. Even more uncommon are isolated internal iliac artery aneurysms, and exceedingly rare are isolated external iliac artery aneurysms. In general, we classify iliac artery aneurysms based on size and location. Typically, aneurysms less than 3 centimeters do not need follow-up imaging, and typically aneurysms less than 3 centimeters tend to be asymptomatic in individuals and are discovered incidentally on imaging. Some common pathology accounting for iliac artery aneurysms can include uncontrolled hypertension, atherosclerosis, infection, trauma, dissection, or other connective tissue disorders. So our case involved a 73-year-old woman with a past medical history of hypertension and a 45-pack-year smoking history that presented for acute onset left lower quadrant pain, which radiated to her left flank. She denied trauma to the area or changes in bowel or bladder function. All other review of systems were negative. Initial imaging revealed a left iliac artery aneurysm with evidence of a small 2.5 by 2 centimeter focal dissection, as well as left hydronephrosis with notable ureteral caliber change at the level of the aneurysm. I have the CT that was obtained below. The patient was taken to the OR for placement of a ureteral stent to allow for patency of the ureter. 2 days following the placement of the ureteral stent, she went for placement of a Vyvanse stent for her iliac artery dissection. There were no reported complications during her operation, and the rest of her hospital admission was relatively uneventful. She was seen in clinic about 2 weeks later and was noted to have resolution of her left-sided hydronephrosis. This case in particular brings to light that although most iliac artery aneurysms are relatively asymptomatic if they're less than 3 centimeters, some patients may experience symptoms if the aneurysms are large enough to cause mass effect on surrounding structures, as in our patient here. Her left flank pain was secondary to her left-sided hydronephrosis. Otherwise, likely her iliac artery aneurysm would not have been detected if she would not have had imaging. In conclusion, this case highlights the need to keep broad differentials when evaluating patients with abdominal pain, as this patient didn't typically fit into the demographic that we would expect to see for a patient presenting with an iliac artery aneurysm and dissection. I want to thank you for listening to my presentation today, and I hope I was able to answer most of the questions that were elicited during my presentation. Thanks.